Well, dear colleagues, welcome. It's Dr. Jack, and I'm here with Dr. Michael Enenbach. And Dr. Enenbach, thank you so much for joining us.
Of course.
Really enjoyed your talk. It's psychiatric care of LGBTQ patients. And could you share with us, if you can just share highlights of the main message you would like to share? If you could have billboards, this is what you'd like all mental health clinicians to know regarding the LGBTQ community in terms of a psychiatric treatment. What would you like to share with us? What do you think is the most important lessons we need to learn?
That's a good question. I think a lot of it is how we approach the patients when they come into our office, that there are unique considerations, but then not all patients are coming in for items related to their LGBTQ status.
Yes.
So oftentimes, some patients feel that that's overemphasized in their visits. Especially in mental health, that may be something that kids, teenagers, even adults are struggling with, and it relates to why they're coming to see a psychiatrist for depression and anxiety. But oftentimes, it may not have specifically to do to that. So I think that's one thing. Understanding, the differences between sex, gender identity, gender expression, sort of understanding that just because someone has a gender expression of the opposite sex doesn't mean that they want to have a medical transition, and supporting them in that. And really looking at suicide rates and depression in this population. They're very high, especially when you get into the transgender population. And so ways we can be supportive of them, because often they have rejection from friends, family, they end up homeless, they have substance use. So just really being aware of that and really providing support for those patients. I think those are the most important things. But generally, the care of LGBTQ patients shouldn't be any different, right?
We're all individuals, and
we're all individuals.
As clinicians, everyone's unique in their own ways, in many different ways. And I think I like what you said. We have to take enough care, enough time to really just inquire. We're when we encounter an individual we just met, we're very professional in our understanding of psychopathology, but we're completely ignorant about that person and what they're dealing with, what their struggles are, the way they see the world. And I think you're right. It's just one more aspect of being a human being with all of the, struggles that modern life presents us with, right?
Yeah, definitely. And, I personally, when I was coming out, it was a very different time. I think it's in some ways a really nice time to be coming out and identifying as gay. And
I guess it also depends, right, on the community, what part of the country you
where
are.
you live.
It's harder in some places, it's easier in others, right?
Yeah, and everyone has a very different story about that. There's very traumatic stories and there's very supportive stories, and that can really affect their mental health going forward. So, doing therapy or talking with patients who are struggling, I think it's really important to get that story and see what their early experiences were, because they're so different.
I'd like to get your advice. There are many clinicians who, really don't know how to broach the topic, how to start talking, how to inquire of a patient. They just don't have the language. They feel a great deal of hesitancy or confusion. They want to ask, but they're afraid of making a mistake, saying the wrong thing. Could you give us some really practical advice on someone really just starting out? What language do you use? What kind of questions might one start with?
Right. That's really important, and there's not a specific algorithm of that. But I think that in working with kids and teenagers and transitional age youth, which is mostly what I do, for me it's just a matter of just getting into the habit of asking everyone the same questions, whether not making assumptions.
Yes. Okay.
So do I identify as male, female, or other? That's one thing. And then I mentioned in my talk that sort of the jargon to ask them if they're gay, lesbian, or bisexual has changed over the years. I think the current thought is to say, is there someone special in your life? You kind of have a very open-ended question. A few years ago, it was, do you have a boyfriend or a girlfriend? A few years back, it was like, are you sexually attracted to men, women, or both? And so it kind of changes, and this one's more open-ended. And it also kind of allows them to answer that question either about a romantic partner or not. So if they want to talk about it, they'll be like, yes, I have a girlfriend. Or if they say, maybe they're not comfortable talking about it, they kind of have an out by saying, yeah, my friends are important, my family's important.
Right,
so
right.
I think that's a really good question to ask.
Oh, I like that. I like that because for some patients, they may not be ready to start talking to that. And why should they? We're strangers to them at that point, right? I mean, it's like, hey, we just met,
right.
and I don't know if I should trust you enough. So, so I think as that relationship evolves, and maybe at some point, that individual who may be hesitant, who may actually have issues they want to address with that, at some point they might be more trusting and open to talk about that. So I like that.
Yeah. I mean, things are changing so fast that it's just important.
We'll talk in 6 months and get some.
Yeah, it'll be totally different. It'll be totally different. I'll have to change my talk.
Well, I think even what you said is going to be comforting to people because I think a lot of people in society are a little thunderstruck with how things are changing, and it's confusing and it's discombobulating. And I think just, for clinicians out there who feel like a little overwhelmed or confused, I think it's good to know, like, they're not the only ones. I think a lot of people, even for you who work in this field, and this is your population of patients, even for you, it's like, you mess up.
And I think so long as you're, honest with the patient, and know that your intentions are good, and that sometimes I may mess up, and you point it out to me, and I'm trying my best. They most of the time are very comfortable with that.
Of course.
Every once in a while you have someone who's just really sensitive to it, but for the most part that helps.
Right. Last point, you mentioned the suicide risk. Is there anything in particular? Anything special? I mean, of course, anyone could be at suicide risk, and suicide risk is elevated in almost every single psychiatric disorder. So it's really among our patients a universal problem and risk. Right. Is there anything special we should know about in the LGBT population that we should, in particular, focus on?
I think just inherent in that population is a lot of social rejection, parental rejection. A lot of trauma, physical and sexual trauma, and all these things really amp up and combine to increase the risk. So really having a kind of a good understanding of the trauma they've had, the support systems they have, offering resources for support. But yeah, it's challenging because they have, especially with trans patients, they have very specific struggles and challenges that can really affect depression and mood and rejection and isolation. So it's a matter of trying to keep them connected, whether it's in therapy or connected to some sort of group or some sort of resource, and really helping them find those things to keep them connected in society. But it's really hard. I mean, it's just like any suicide. I mean, we could talk about like firearms and all these other things that we could talk about with policy changes. But it's a unique grouping of patients with increased suicide that it's really concerning. And I think my opinion is it's getting better. I think the more that, certainly lesbian, gay, bisexual people are in media, they're on TV. I mean, it's become more, and even in the transgender population, we have actors who are pretty popular out there now. And so I think the more that it's normalized in the community, the better it will get. But I think the approach is pretty much the same, but maybe they need more specific supports.
Well, great. Dr. Enenbach, thank you so much.
Yeah, thank you.
Really appreciated you coming out here and joining us and giving your talk. Yeah, thanks.
Fun.